Some form of gum and bone disease is present in the mouths of most adults. Gum and oral bone diseases are usually painless and slowly progressive, so you don't really know they're there. Usually you see red, swollen, and inflamed gums, bleeding on cleaning your teeth, flossing, or eating hard foods, looseness and spacing of teeth, and bad breath. The supportive structures of the teeth, the bone and gums, are called the periodontium. What does a good periodontium look like? I'm sure you've seen many people who look just like this, but you don't pay much attention to it because there's nothing wrong. These gums are pink, not red. They don't bleed on flossing, brushing, or eating, and this patient's breath is fresh. The teeth are held stable by healthy bone. They're not movable. Take a look at the beautiful smiles of these two young women with their healthy mouth tissues. In the normal, healthy state, the gums and teeth of the mouth are as you're now observing. The gums cover the tooth root surfaces. The gums are pink in color, not red. Most people do not think about the appearance of their gums unless some disease process starts. Gum and bone breakdown starts with a condition called gingivitis and progresses to a more severe condition called periodontitis. When oral hygiene is neglected or poor overall health is encountered, oral disease begins. The more mild condition, gingivitis, is caused when food debris, excessive dental plaque, or hard deposits called tartar or calculus are allowed to remain on the teeth. Observe the red gum tissue in some areas of this patient's mouth. Are these next two patients for whom rough crowns, or caps as you might call them, have caused swollen gums and gingivitis? Although not very serious and usually reversible with proper care, this condition precedes and often leads to the more serious gum and bone degeneration called periodontitis. When food debris, dental plaque, or hard deposits called tartar are allowed to remain on the teeth without improvement in tooth cleaning, the supporting bone begins to degenerate. The gums and bones shrink around the teeth, which become mobile, and breath odor is present. Drifting of teeth occurs, leaving spaces between the teeth, as you can see. The person you're observing is in the late stages of the disease called periodontitis. However, proper treatment can still save most of these teeth. You're observing a model which has been designed to show fairly normal gum anatomy without disease. However, on the other side, the model has been designed to show periodontal disease or periodontitis. Let's remove the soft tissue or gingiva from this model, and what do you see? You see a black substance that is called tartar. You will see that these teeth are quite mobile. They are beyond the stage where normal treatment could help them a lot. You'll notice that around this tooth where my finger is, there has been shrinkage of the bone. Look how far down the bone has shrunken from the other teeth. Are all of these teeth condemned? No, some of them could probably be treated, but these are in the late stages of periodontal disease. What are your alternatives for treating gingivitis or periodontitis? Number one, nothing. You may elect to do nothing, but the periodontal disease will continue. Two, you may elect conservative periodontal therapy, which requires frequent visits and a team effort by you and your dental practitioner. Or three, you may elect to have conventional periodontal therapy, including gum and bone recontouring, followed by improved oral hygiene. Let's consider these three alternatives for gingivitis or periodontitis. If you have gingivitis, doing nothing is not a good alternative because the disease process will continue and become more severe. Conservative periodontal therapy is the choice most dentists and hygienists choose for gingivitis. This therapy includes the several concepts to be described later and requires your participation. Usually, comprehensive periodontal therapy, including gum and bone recontouring, is not necessary to treat gingivitis. Gingivitis is reversible and usually non-threatening. This patient needed a new, well-fitting, smooth crown or cap and better oral hygiene. The best treatment for gingivitis is simply for your dentist or hygienist to remove any irritating conditions present in the affected gum areas and for you to practice better oral hygiene. Probably your dentist or hygienist will suggest that you increase the frequency of oral hygiene procedures and improve your methods for cleaning your mouth. Periodontitis continues to progress at a relatively slow pace until teeth are lost due to the weakened characteristics of the supporting bone and gum. There are several procedures for treatment of periodontitis depending on the severity of the condition. The disease process will not stop by itself, and either conservative therapy or conventional gum and bone recontouring, which we'll discuss later, must be accomplished to treat this condition. What happens if periodontitis is not treated? This patient let periodontitis go so long that tooth extraction was necessary. The classic characteristics of periodontal breakdown continue to worsen, including gingivitis, red gums, bleeding gums, loose teeth, spaced teeth, pus coming from the pockets around the teeth, and breath odor. Usually objectionable pain, believe it or not, is not present. Conservative periodontal treatment may include any or all of the following procedures. Education for you about the disease, improvement in oral hygiene by you, daily cleaning of your tongue, you've never heard of that before, by you, more frequent professional tooth scaling and polishing by your hygienist or your dentist, systemic antibiotics delivered to you daily for a while, medicinal oral rinses daily, local antibiotics for non-responding teeth. This type of treatment is not threatening, painful, or upsetting for most patients. However, it requires significant cooperation from you with constant supervision by the hygienist or dentist. Research has shown that conservative periodontal therapy can save many teeth without conventional bone recontouring or reshaping and gum tissue recontouring. Conventional periodontal treatment is usually surgical. It's accomplished by a periodontist who's a dental specialist or your general dentist. It includes gently lifting away the gum tissue from the affected teeth, going in with a rotary instrument to contour the bone tissue, and placing the gum back in place. After a healing period and conscientious maintenance of mouth cleanliness, the periodontal condition can be stopped or greatly reduced. The patient you are observing has severe periodontitis. The disease could have been treated using either conservative or conventional periodontal therapy. The completed treatment, including new crowns on the front teeth, returned oral health and optimum appearance, as you can see, for this patient. As you might expect, the most favorable therapy for periodontal disease is not as desirable as prevention of gingivitis or periodontitis by you. Prevention is possible with excellent oral hygiene, a normal diet, and minimal or no use of tobacco and alcohol. Continued research has related periodontal diseases to your overall health. Prevent periodontal disease in your body. It's up to you. How do you maintain periodontal health? After periodontal therapy, your dentist or dental hygienist will inform you about how to maintain periodontal health. In many situations, recare appointments more frequently than once every 6 months will be suggested and needed, along with rinses, antibiotics, and other therapy. If your overall health is good, periodontal disease may be stopped and normal oral health maintained. Unfortunately, periodontal disease is present in some form in almost all adults. Some type of treatment is necessary to reduce or stop its progress. It won't stop by itself. Your dentist or dental hygienist, with the occasional help of a periodontist, will suggest the most appropriate therapy for your condition.